So let me introduce Dr. Laura Bozzi. She is the Director of Programs, Yale Center of Climate Change and Health, and lecturer at the Yale School of Public Health. She's also the Director of Programs and a lecturer in Environmental Health Sciences at the Yale School of Public Health. Her work seeks to address climate change's negative health impacts and promote health equity through policy change, scholarship and research, and supporting communities to build resilience and capacity. Laura co-authored Climate Change and Health in Connecticut 2020 report released just this September, and was lead author in the Community Resilience and Health chapter for the Rhode Island Governor, commissioned by Statewide Climate Resilience Action Strategy. So Laura, it's great to have you here today, and I will pass it over to you.
Great, thanks so much. I am going to share my screen. Okay, thank you, Heather, Glenn, and all the organizers for having me. I'm really pleased to be part of this conference and provide more information about the connection between climate change and health here in Connecticut. As Glenn mentioned, I'm the Director of Programs at the Yale Center on Climate Change and Health. We do work, research, education, and public health practice work around the world and including here in Connecticut to address what we consider to be the largest public health threat of the 21st century, which is climate change. In particular, this afternoon, I'm going to talk about this report that we just released this fall, Climate Change and Health in Connecticut. And this report is important, I think, because it sets out climate change firmly as an issue that's happening here in Connecticut right now to people's health. And I think that frame is really key for an issue like climate change that has historically been seen as something that will happen far in the future to other people or to other species. And that's certainly not the case. And I think that that's important for to drive our action. It helps to have the frame that it's something that's happening here, and also that we need to recognize that adapting to climate change isn't something to plan for the future, but it's something that we need to be doing now. And that's the overall frame that we have in this report is that we need to address climate change urgently in terms of mitigation, and we need to adapt to it now. And I'll say just a couple of things about the report. We covered 19 indicators that relate to issues of climate change and health. We used publicly available data. And so we weren't collecting data ourselves, we were finding data, but bringing it together. And as much as we could, we reported it at the county level, recognizing that everyone wants to know what's happening very locally for themselves and looking at it over a long time period. So in some cases, we were able to go back into the late 1800s, and others it was in the last 10 or 20 years. But that way we could look at what's the trend, where is it going, and then use research on projections to think about, well, what could happen in the future? What are we expecting in the future? And how does our action on climate change, our mitigation actions, change what that future might look like? So this may be well known, but I want to review just some of the projected climate change physical impacts in Connecticut as the starting place. And this is largely drawn from a really important report that comes from University of Connecticut and CIRCA. So first, their report was using a high greenhouse gas emissions scenario. So that's kind of a business as usual scenario. That's more of a worst case scenario, but unfortunately that's the trajectory that we're headed on, and we need to make sure that we turn off that trajectory. But using that one, looking at mid-century compared to the end of this past century, we would expect a 5-degree increase in annual average temperature, an increase in annual precipitation by 8.5% year for the full year, but that would especially happen during the winter and spring. And in fact, in the summer, we would expect to see more extreme summer droughts occurring 3 times more often. And because of that increased precipitation in the winter and spring, expect greater flood risk. CIRCA recommends planning for 20 inches or a ½ meter of sea level rise by 2050. There are other projections that put that even higher, particularly as you go out past 2050. And this is also where there's more uncertainty in it, and it depends on our action on climate change. And research expects that Atlantic hurricanes will be more intense with greater precipitation, higher wind speeds. So that's the stage for this work where we're looking at how that affects our health. Another really important frame that we use in the report, and that's key in all of our climate work, is to think about, is to recognize that climate change affects everyone, but it doesn't affect everyone equally. And climate change is often called a risk amplifier. So there are certain groups of people that are more vulnerable to its impacts than others. And that could be because of where someone lives or works, because of their socioeconomic status, because of their race, because of their age, and that these can also overlap, increasing the ways that people are affected by climate change. And so when we are designing our solutions, it's critical to think about these inequities and to address them through those solutions. So I'm going to go through we have 4 domains in the report: temperature, extreme events, infectious diseases, and air quality. So I'll go through all of those, explaining a few of the key indicators. And then I really encourage you to look at the full report for more of the detail and to look at all of the indicators. So the first indicator is what I think is a quite striking one, which is average annual temperature in Connecticut. And you can see from this figure that it has increased since the late 1800s, and in fact has increased over 3 degrees. And that's the case for each county. When we look at the county level, it's 3.5 degrees increase. And so what does this mean for health? There are a lot of different health impacts from this. I'll talk a little bit later about heat-related illness. There's also an amplification of ozone pollution, which I'll talk about a little bit later as well, and that those often coincide. The changes in temperature, we also see this in the changes in frost days. That was another one of our indicators. So the number of days that get below freezing. And as those numbers have decreased, it's made for more suitable conditions for ticks and mosquitoes. They can last through the winter. They can have larger populations. The extent of their season can increase. And that's also the case for pests in gardens and in farms. So that can affect agriculture. It also creates a longer season for ragweed pollen and other kinds of pollen affecting allergies. I'll discuss that in a little bit as well. So digging into heat-related illness a bit, in Connecticut, there were on average 422 emergency department visits for heat-related illness and 45 hospitalizations. This number is probably too low because it's not always reported. It often coincides with other kinds of pre-existing conditions, and so it's not always reported that it's related to heat. And we would certainly expect this number to increase, unfortunately, in the future. Vulnerable populations for this issue include those that are older and younger. Their bodies are more susceptible to heat-related illness, as well as people with existing medical conditions. It's also affected by someone's ability to adapt, adaptive capacity. And so those with limited social or financial resources or that are socially isolated are especially vulnerable. Also those that are working outside, outdoor workers in construction or agriculture, those kinds of fields are more likely to experience heat-related illness, and athletes. When I worked in Rhode Island, there were a number of concerning stories of running events and and school sports where there were issues with heat-related illness. So what can we do about this? It always feels like there's so much to do, and it's at all different levels. So this is a few suggestions. So one thing, considering that this is a conference on with many business owners or those working in business, to think about your workplaces. So there's no requirement for a written plan to address heat exposure, but it is a best practice that is an important part of addressing occupational health. Also making provisions for rest, water, and shade, and making this sort of culturally acceptable within a workplace is really important. And finally, to recognize the symptoms of heat-related illness and to know what to do in that event. And I just wanted to point to NIOSH, the National Institute of Occupational Health and Safety, and the CDC for having some important resources on this. They also have an app that's really helpful. In terms of municipal and state policy, one recommendation that's coming from the current Governor's Council on Climate Change process that I've been involved in is to implement, for the state to support municipalities to implement local heat and air quality response plans. So that thinking about it, not at the moment, but beforehand, who do we need to have involved? How do we send out a message when we know that there's a heat wave coming? What are the precautions? How do we open our cooling shelters? Much of this is already in planning, but as extreme heat becomes more of a concern in Connecticut, there's a need for additional planning, and particularly to reach more vulnerable populations. And also, and I'll say this in a number of places, homes are key. Policies and programs to make homes and electricity affordable and energy efficient and safe, it goes a long way in addressing heat-related ills that can happen inside of a home. And then for communities, programs to check in on elderly residents has been really successful in other places. Tree plantings and white roofs can help with the urban heat island effect. And in fact, there's research from a colleague at Yale that finds that white roofs are actually more effective than green roofs. Something to consider. So now I'll move on to extreme events. We cataloged all of the weather disasters, the federally declared weather disasters in Connecticut, and found that from 2010 to 2019, there were 9 disaster declarations, and that compares to 13 in the previous 56 years before that. So, so many more disasters during this time, and I'm sure that you can think of some of the recent ones in the last decade. Irene and Sandy, the Hurricane Easter that were quite significant and affecting all different parts of the state. What does this mean for health? So there are direct effects of drowning and injury during storms, but then there's also significant dangers from the indirect effects when there's disruption to critical infrastructure, like electricity. If there's someone who relies on an electric medical device, that's very dangerous for health. Loss of access to medical care. If someone evacuates without their medications, that's very significant. Glenn mentioned mental health impacts, and there's significant research looking at past extreme weather events and other kinds of climate impacts on the short term and as well long-term mental health impacts of those. And those mental health impacts, the duration of them is affected by what happens afterwards. What's the recovery process? So that's an important time to address mental health impacts. And importantly, again, there's structural inequality in the impacts, and so it relates to what's the infrastructure like before the event? What are the resources in a community before the event? What's the the social connectedness in a community before the event, and what are the ways that that community can access resources afterwards. And so that's something that needs to be addressed at the policy level. In the report, we used research from the Government Accountability Office that looked at Superfund sites and evaluated Superfund sites all over the country on how they may be affected by climate change. And they found that 7 of Connecticut's 16 Superfund sites are vulnerable to climate change impacts, particularly flooding, as well as hurricane storm surge and sea level rise. And you'll see the green here. Those are the sites affected by flooding. And importantly, in their analysis, it was flooding that's not, it's based on FEMA flood maps that don't include impacts of climate change. It's looking at past flooding. So it's an underestimate. And this is, of course, important to health because Superfund sites are contaminated with toxics that could be released during the flooding event or storm surge into the water or the air or into soil. We looked at high tide flooding, and there are 2 tide gauges that were reported in Connecticut, one in New London and one in Bridgeport. And I'm showing you New London here. It has the longer time series, and you can see that the number of days where the flooding exceeds sort of the normal its normal area. That number of days has increased significantly since the reporting began in the 1930s. And so what is this? And I should say that report also projected what this would look like in the future under a couple different sea level scenarios that are certainly within the realm of possibility. I think the intermediate may be more, they're both within the realm of possibility. And so you can see that by 2100, we're looking at half to nearly every day of high tide flooding in this area. So that makes days that today's flood becomes tomorrow's high tide. It could mean that these areas are essentially permanently inundated with water. What does high tide flooding mean for health in the short term? If it's happening occasionally, there aren't major health effects, but as it expands and as it can become more common, the high tide waters can transmit pathogens like Vibrio bacteria, particularly if someone's walking through that water. It can contaminate drinking water sources and agricultural fields that are on the coast. And it certainly raises questions about development in those coastal areas that are experiencing more frequent flooding. So what can be done? Again, much has to be done. This is a few suggestions. One is the community rating system program through FEMA, which municipalities apply for, and it reduces the cost of flood insurance. And so that's something that helps residents and property owners to afford flood insurance. Again, housing is really critical here. Making housing more affordable, healthy, and climate resilient, so that there's less displacement after an extreme weather event. And then at times, in certain places, discussions on plan retreat have already begun and need to continue to decide collectively as a community what to do in places where there's significant flooding and concerns around sea level rise. For individuals, businesses, and families, making a kit, being prepared for extreme events, knowing your evacuation route and how and having a plan for how to leave. And then on the other side, I didn't show the data on droughts, but there's, as I mentioned, expectations of more drought in the future in Connecticut, and so we can address that now by installing more efficient appliances, by building new areas with low impact designs and making changes to existing buildings and existing landscaping to reduce the use of water. I'll shift now to infectious diseases. We did a more significant analysis looking at mosquito abundance. And the kind of top line finding is that over looking at data from the last 20 years of 28 species that were found in Connecticut that carry viruses that cause human disease, 10 showed trends of increasing abundance, 3 showed trends of decreasing abundance. So, so that means that these an indicator of higher likelihood of transmitting a pathogen it is a higher population size. So it's concerning that there are higher numbers of these species in Connecticut and of species that carry diseases that have been less prevalent here in Connecticut. And so those include those listed below. Triple E and West Nile virus are those that we've, I think most of us have heard of in Connecticut. Others, Cache Valley, Jamestown Canyon, and Trivitides are others of concern. Some good news in terms of vector-borne diseases is that when we look at confirmed and probable Lyme disease cases in Connecticut, the numbers have decreased significantly across the state. So you can see that with the decreasing line here. And that may be because Connecticut has experienced Lyme disease for quite a long time and has come to learn, people have come to learn how to protect themselves, which is really great. And I think that's a success story. We, at the same time, have concern about emerging pathogens. The Lone Star tick, which is common in the South, has now expanded its territory into Connecticut, and the Lone Star tick transmits a number of diseases that are listed here. It is one of a number of other tick species that are of concern here in Connecticut. I mentioned before Vibrio infections. So this is a bacteria that is found in saltwater, brackish water, and it can be transmitted to humans through 2 routes. One is by walking through salt water with an exposed wound, and it infects the wound. And here, this is through food, and that's by consuming contaminated shellfish, particularly raw or undercooked shellfish. And so we can see here that the Vibrio infections in Connecticut have increased significantly since the mid-90s when the data set began. And Vibrio thrives in warmer waters. And so it's not surprising to see this trend, because you can see on the right, this is the trend of mean summer temperature in Niantic Bay. So in one area where data was collected over that same period. And so you can see that the sea surface temperature also increased significantly during this period. What to do? This is, again, a few suggestions. In terms of mosquitoes, the first step is reducing the size of the mosquito population through integrated pest management. Other ways to do so that ideally minimize the use of toxic chemicals, and then reducing our own exposure through high quality housing with screens and doors that don't let mosquitoes in, more mosquito surveillance and more education about how to protect, how individuals can protect themselves using clothing or insecticides. Similarly for ticks, we can create more tick-safe zones in our yards, schools, and parks by removing leaf litter, installing a a 3-foot wide barrier of wood chips, clearing tall grasses. There are some effective ways to make your yard, safer against black-legged ticks. And then personal practices. Again, I think that Connecticut residents know this by now. Wearing long pants, treating clothes with permethrin, using insect repellent, staying on trails, avoiding brushy areas, and taking a shower and doing a tick check after you come back inside. The final area that I'll cover is air quality. So what you see here are the number of ozone exceedance days by county since the 1990s, essentially. And the darker colors indicate the more significant exceedance levels. And so what you can see is that overall there's a downward trend. So that's great. That we're headed in the right direction in all of our counties, reducing the number of particularly the very unhealthy days. However, Connecticut still has bad air quality for ozone. And in fact, the American Lung Association in its 2019 report graded each county with an F for its ozone air quality. And this is important for health because high ozone days can trigger asthma and other kinds of respiratory health conditions. In terms of solutions, this is one area that is really important to say that our action on climate change, reducing our use of fossil fuels, also improves our air quality. So the precursors of ozone are those pollutants come largely from our vehicles and our power plants that are burning fossil fuels. And so by reducing our greenhouse gases, we are also improving ozone and particulate matter pollution levels. So that's a fantastic health co-benefit of climate mitigation. Still, it's worth noting that a good amount of our air pollution comes from outside of the state. It comes from states to our west. And so there's a limit of what we can do just with Connecticut policies. We need strong federal policies on these issues to protect our health here in Connecticut, as well as to address climate change as a nation. I'll wrap up on looking at indicators with our indicator on aeroallergens or outdoor allergens. This is data that's from the a monitoring site at Waterbury Hospital. And we found that the only one where we saw a significant trend was that the percent of measured days with high or very high outdoor mold concentrations has increased. However, we know from research that these other pollen levels, other outdoor allergens are expected to increase with climate change, and that their allergenicity, the potency may increase with climate change. What to do? As I mentioned before, climate action brings strong health co-benefits, and that's switching to clean energy sources, electrifying our transportation vehicles, but especially also trucks, buses, and trains that can have dirtier pollution, and also the heating sector in our homes. That's especially important in Connecticut, where a lot of homes are heated with oil. We also want to improve our active transportation options. This is great for health in multiple ways. It's reducing the air pollution that's coming from our vehicles, but it's also making people more active, giving options to walk and bike, be outside, to go to work and to go around town. That's a really important additional health co-benefit. And then, as I mentioned, we need federal policies limiting interstate pollution. In terms of adapting to these changes, urban tree plantings are a great way to reduce heat in urban areas, and also they can absorb some air pollution, but it should be done with an eye on looking at the pollen of those tree species. And there's more work and more information out there now about how to do that, how to choose tree species that are good for the current climate or in the future climate, and that have less pollen. Air quality alerts are important, but also providing ways, saying that there's it's a bad ozone alert day, but then not providing ways for someone to change their behavior is less helpful. So thinking about what are ways to make sure that someone has an alternative to being outside. And again, making housing affordable, healthy, and climate resilient, and addressing indoor air quality problems, particularly from mold, is critical. Our report ends with broad scale recommendations, and above all, our recommendation is swift action to reduce and limit carbon emissions to solve the ultimate problem, the ultimate driver of these problems. Then we also set out a number of overarching recommendations. The first is to monitor conditions and protect trends in Connecticut. We just need to better understand some of these issues. We found this data, and so there is data at the state level, but there's more that we need to know in order to understand how climate change is affecting Connecticut. The second is to invest in social determinants of health. I kept coming back to the issue of housing. So housing is a key issue that affects our health. And by investing in safe, affordable, healthy housing that's addressing these issues of climate change, is also addressing other health issues. Tackle the upstream drivers of climate change and health disparities. There are large-scale issues related to discrimination and racism, related to the power of certain interests that are driving climate change and health disparities. And so we want to look at what are those ultimate drivers and address those in our policies. As I mentioned earlier, we want to pursue actions that integrate mitigation, adaptation, and immediate health co-benefits. That's certainly the case with air quality, and it's the case with others. And so it's that we can get a real bang for our buck if we're thoughtful about our policies, that we can have impacts on all three of these social priorities. We need to build the capacity of health professionals and decision makers to address climate and health. This issue of climate change as a health issue is relatively new. Many public health professionals or medical professionals didn't receive training in climate change and how climate change is affecting the issues that they're addressing and that they're treating. And similarly, those that are working on climate change may not have learned about how the specific ways that it is affecting health. And so making sure that there's that kind of professional development is important for addressing the problems effectively. Similarly, I'll show you both of these. We want to make sure that climate change is incorporated into decision-making across sectors. This is a systems level problem, and it's most effective when we're addressing it across all of the different traditional silos of government. And similarly, public health needs to be at the table when addressing climate change. In the Governor's Council on Climate Change in Connecticut, it was really heartening to see that the Department of Public Health was added to that council in this recent iteration, and so that's a key recognition that public health is squarely an issue for climate change and needs to be part of developing the solutions. So that's a quick review of our report. I encourage you to download it from our website. The link is there. You can also sign up for our newsletter. I'd be happy to answer any questions now, and you can also feel free to contact me afterwards. Thanks very much.
Thank you so much, Laura. This is Eleanor here from Conscious Capitalism, and some folks have dropped things into the chat. I'm just sort of sifting through here. Various sources present mortality due to air pollution at 6 million per year, although this member of the audience recently encountered an estimate of 2 million infant mortalities, primarily related to indoor cooking with solid fuel. Are infant deaths newly discovered or part of the 6 million deaths? I don't know if that relates directly to your researcher or if you want to comment on that.
I don't know about that specifically, but I have seen some recent research that is, I think, as this person was referencing, that indoor use of gas stoves has concerning effects on health, and so and that can particularly affect, children are often in the kitchen as someone is cooking dinner, and children are can be more vulnerable to those air quality issues, and so that may be what the person is referencing, but I don't know the specifics.
Or wood stoves and the like. But when so when you ask businesses to act, of course, there's an intersection of the individual value aligned discretionary action, and there's engagement in policy discussions, or both. It strikes me that maybe first being well versed in this research would give a business owner, business leader, a kind of a way in to sit at the table when municipalities or states are doing climate preparedness type things. Would you agree or have any additional thoughts on that, on just, sharing these common reference points to be able to talk about things in a similar way?
Yeah, well, I think, I guess I find that speaking from a public health lens, when talking about climate change and the need to act on climate change, can be very effective. And so whether that's for a business owner or someone else, being able to speak to how this is affecting the health of people now and here in Connecticut can resonate. But I think it's also, I think you're right, knowing then specifically how this may be affecting their staff or affecting their operations from this health perspective is also powerful.
Thank you. You talk about housing having such a big effect, and maybe the housing industry, from building and development, construction, architect, all of that, being a place to really move the needle. It also strikes me that as more people are working from home, the employer, may not be setting the actual physical conditions in which their employees work. So there's just an interesting shift, I guess, happening if, say, work used to be the respite where you would go and know that you're going to be in an air-conditioned environment all day, but you may not have that at home, things like that.
Yeah, no, I think that's right. And so then that's also a cost for employees, is spending more time in your home.
Or maybe a benefit or employee
Yeah.
incentive or something that employers could take into consideration to make sure that their employees were, not facing those heat-related illness factors or other things during the course of their workday.
Yeah.
That's very interesting. Looking at sort of disruptions to transportation from extreme weather events, with power lines coming down, roads submerged, and then how the food supply through drought, plant disease, etc., could really impact public health. They're not directly in the report, but they certainly touch on it. Anything you'd like to say about that?
I think it's a really key issue. So climate change can affect our access to food in a number of ways. One is during extreme events, when it can disrupt a supply chain, and that can be both here, trucks can't get in that are bringing food from outside, but it could also be that extreme climate events that are happening in the place where our food comes from that's far away can be affected. So that kind of supply chain can be vulnerable. But then there's also concerns about our local farmers, our local agriculture adapting to different kinds of climate conditions of heavy rain, drought, pests and disease. And, I think farmers, fishermen fully understand that climate change is happening and are addressing it as much as they can and need more support. But I think that, when I've talked with farmers and fishermen, they say, yeah, it's really clear that this is the case. A lot of farmers locally are using more high tunnels as a way to address the fluctuations in temperature. And I think that it's a reminder for a lot of people of the importance of supporting local agriculture to reduce both the sort of carbon emissions from bringing in food from far away, but also to have more sort of local, to create a local resiliency within the food system.
Very good, thank you. So with this type of crowd, you might have a lot of people who take, sort of land stewardship in their own backyards very seriously. And your recommendation of, for even as we advocate in our cities for native plants and trees to be planted that require less water, it can kind of hurt people's hearts sometimes when you say, like, clean up the leaf litter, or the
I know.
make sure there's a big, when it comes to ticks. So then my actual question is, zooming in on the tick recommendations, is it true that attracting wildlife like possums, bats, certain types of birds, that those are tick mitigation strategies that maybe aren't as direct as the ones you advocate, but that could potentially have an impact?
Attracting wildlife that
are
eat
ticks.
hosts or that eat well. So
Yeah,
then that's an important distinction, right? So some rodents are carriers of ticks, and so you want to reduce sort of habitats where they would come into your yard and because they're hosts. But others like guinea hens, I think, are really good. Chickens eat ticks, and so maybe that's a good strategy. This is not an area where I can give super expert guidance, but I think it's important to be thoughtful about the decisions that you're making in your home, and to also be thinking about what are the trade-offs, because we also we want to have natural lawns and trees in our backyards, and that's important for the environment as well, and so just being sort of thoughtful about it.
Yes, and rewilding lawns was a suggestion from the audience, as well as getting chickens and ducks around to eat ticks. So just sort of adding to your list of possible considerations from the knowledge in the audience. Now, and speaking of the audience, I'd certainly love to invite, if anyone has been involved in any public health projects or work for companies that sort of innovate in that space at all with public health, please join us in the networking lounge right after this session to chat about it, and or drop any relevant links that you would like or information into the chat.
Eleanor, I do have a question for Laura, if she's available.
Oh.
Thanks, Laura, for your great work in this very important topic. I mean, because for me personally, we live near the shore in Milford, and so I have been witness to various storms called the last two hurricanes, Irene and Sandy, and witnessed the devastation at a profound scale. And of course, most of the solutions have been just to build up another 9 feet. So we'll see how long that lasts. But I'm more interested in the planning, particularly financial planning of various coastal towns around the shoreline here, because I noticed just last week that Brantford, I think, was one of the first cities to actually, in a very proactive way, start mitigating against that. Would you like to talk to that at all?
I know, I think just what you referenced, that Brantford has taken a real leadership position in setting out what I understand is, I think, a fund to address climate resiliency. And it can be a real, it's a real cost to municipalities, climate adaptation, and there are trade-offs there's a limit on what we can do to adapt, and so making sure that we're making the right decisions that that set us on a good path thinking forward, looking at what is this going to look like? What does this infrastructure look like in 2050? Do we build it here? Do we build it somewhere else? Or what roads can we repair, and which ones do tough choices need to be discussed? And I think that that's going to happen. A lot is happening now for coastal towns across the country, and certainly for inland towns as well. And I think it's an area where I hope that there's also where there's a really important state and federal role too, because it's too much for individual municipalities to take on their own. And so making decisions at the local level is important, but having tools and resources from other levels is really key too.
And so what's next for you with this? You've just published this wonderful work in September. I mean, what's on your horizon next?
Yeah, we've been, we're excited to move on, but also glad to get the word out about this. We just published an op-ed in the Connecticut Mirror, and doing other work to share this out. And then we're starting to work on some issue briefs. So taking this kind of, it's a fairly thick kind of a little wonky of a report, and so working to digest it into more information on each of the different issues with specific policy recommendations, and bringing in some stories of residents that are affected. So we want to use that as also a way to educate at the municipal and the state level. Another area that we're really interested in is this issue of the co-benefits of the health co-benefits of climate mitigation. And so being able to point to, these are the kinds of policies where we can get like a real bang for our buck in terms of addressing air quality and addressing climate mitigation, and helping provide that kind of guidance to decision makers, and making sure that the public health voice is strong in climate change discussions.
Well,
maybe I'll just mention one other thing for those who find this interesting and want to learn more about the connection between health and climate change. The Yale Center on Climate Change and Health has a few different online programs. So one is an 18-week specialization for professionals. So it requires an application, and there's a fee, but financial aid, but has been incredibly effective and popular with people all over the world. And then another is a shorter version that's on Coursera. So it's online. Just kind of sign up. You can audit it for free, and it's a way to dig into this issue of really understanding climate change and health together from a global perspective. And you can find more information about that on our website if you're interested.
Thanks, Laura. Is there anything else you want to add just while you have an active audience in front of you? It'd be a good opportunity to just share some closing thoughts and how important this is in your work and the impact it has on the community.
Yeah, I feel like I've talked a lot in the last hour. Again, I think that this is, I just really encourage looking at climate change as a health issue, and thinking about it in those terms, and advocating for it in those terms, and that we can do a lot in addressing climate change and health outcomes and health disparities together. That this can also be there's a strong business case for it. Unfortunately, the numbers aren't as, there's more and more work done over time, but look, quantifying what are the health savings from these kinds of policies is also a really important line of research and then of advocacy.
Well, Laura, thanks again for your time and sharing considerable research and wisdom in a very elegant manner. So I'm so thrilled to have you here and share that with the group today.